Hello, my name is Martha Medrano. I am a dietitian and a master's student at the University of New England. I'm here to present nutrition interventions, improving the health of children in El Paso to the Department of Public Health in El Paso. Here is the disclaimer just stating that I am a student. An overview of today's topic will touch upon the target population, talk about the background and why this population is vulnerable to obesity, look at some determinants of obesity, some interventions that are in place, and proposed intervention. We will summarize and conclude, and then my references are available. So again, the target population is the Mexican American children in El Paso, Texas. The city of El Paso has a total population of nearly 700,000 inhabitants. According to the U.S. Census Bureau, 80% of that population is Hispanic. Geographically speaking, the city of El Paso is on the border with Ciudad Juarez, Mexico. Therefore, the Hispanic population is likely mostly Mexican American. The prevalence rate of obesity in all Hispanic youth in the U.S. is 25%, which is nearly double that of non-Hispanic Caucasian children, according to the CDC. Median income of Hispanic population in El Paso, Texas is $44,000 yearly. Poverty level is at 20%. Low and middle income homes have higher rates of obesity than higher income homes. 82% of homes own computers, and 23% of El Paso residents are without health insurance. To understand obesity in this vulnerable population, we can look at the following factors. For example, obese parents can pass on their genes to their children. Also, they can pass on eating and activity behaviors in the household. As stated previously, households experiencing low income have higher rates of obesity. There was a significant negative correlation between moderate to vigorous activity and obesity in 10 to 13-year-olds in a study by Tallarico and Jensen. Data was also found that 50% of food budgets in El Paso are spent on eating out. We can look at the social ecological model to illustrate more clearly the obesity determinants in this population. There are different layers to this model that kind of overlap. On the individual level, we have genes that influence food preferences, sedentary behaviors, and then the household can contribute to obesity in children as far as what foods are kept in the house, what foods are in the neighborhood, the parent nutrition and activity behaviors we spoke of before, inadequate supervision. Some of these are in bold color in terms of what I found that still needed to be intervened on. At the community level, we're looking at neighborhood safety can deter children from being more active. How far do they have to walk, or how far do parents have to go to get healthy food back to the home? How far do children or families need to go to get to a park to be more active? At the organizational level, the school lunch program, what are kids eating day in and day out? Um, Government programs such as WIC and SNAP, do they provide any education? What kind of foods are offered? Um, Access to free recreation. Also, is there anything that is affordable in terms of activity in the neighborhood? And then the policy level, There are lots of things that can happen on a greater scale that can trickle down to populations such as the Mexican American children, such as instituting a beverage tax, making healthy foods more affordable, having laws against marketing fast food to children as far as commercials or ads online, billboards, and things like that. So, some nutrition interventions that are currently in place and some potential interventions that can be beneficial are going to be noted following. Um, the Public Health Department of El Paso has on their website some initiatives that have already began as far as they Eat Well, Healthier Foods on the Menu for Children program. CATCH, which stands for Coordinated Approach to Child Health, was instituted to get more activity and healthier foods in the schools. Walk El Paso built new trails and put signs up so that families knew how to get to some free activities in their neighborhood. Move El Paso stemmed from the Let's Move campaign from Michelle Obama. The Que Sabroso Vida program is funded by a grant for 5 years to institute things like healthy cooking classes and more information for families. Current interventions are in place, therefore, in the interpersonal, community, and organizational levels. However, there is room for further interventions. So I propose looking into the level of the interpersonal um, realm in terms of what foods are actually in the homes. Children, older children, adolescents, they may be home for short or longer intervals without an adult present. So families need to have a sense of what healthy snacks to keep in the home, and adolescents can be educated on how to prepare healthy snacks and quick balanced meals. An assessment of the neighborhood, convenience stores, street vendors, fast food restaurants can also be obtained to find possible areas of improvement there. Could incentives be provided to these businesses to sell affordable, healthy snacks? And finally, what are the food costs in vulnerable communities, such as this target population? Is fresh fruit more expensive than chips? Policymakers can be made aware of a need for change at a city, state, or federal level. So, to conclude, there is more work to be done. I believe that there are more nutrition interventions that could complement and benefit the population of El Paso in terms of what's already instituted in the restaurants, schools, and communities. So the Mexican American children in El Paso, they are at a high risk for obesity. Current interventions such as the Eat Well El Paso Restaurant Initiative tackles obesity determinants at the individual, interpersonal, community, and organizational levels. And then the potential nutrition interventions that I found would target the food environment in the home and community, and on a broader scale, make some changes to state, local, or government laws as far as instituting beverage taxes, helping these older children that may have a little bit to spend, like helping them be able to make the right choice because the price is right, basically. And having healthier food options in the community as far as convenience stores, gas stations, street vendors. So policy changes would definitely help this population. So thank you for viewing this presentation, and if you have any questions, you may email me at this address below, and here are my references.